welcome. What we're going to do in this lesson is go over what to expect in terms of growth and development for school-age kids and adolescents. So the major milestones that we're going to be looking for both of these age groups, they're kind of changing. They're shifting from being all about skills to really being more about social and cognitive experiences. So honestly, there isn't going to be much to say about motor and language development for these kids. They should just be trucking along with those. So we're going to skip those two categories of development and really focus on their growth and then their psychosocial and cognitive development. So we're going to start with our school-age patients, and these kids are going to be 6 to 12 years old, and these kids are fun, they're curious, and they're motivated to understand everything that's happening around them. They ask tons of questions in the healthcare setting, and this makes them so open to education and learning about their own health, which can be really exciting. So let's get started and talk about some of the really important milestones for them. So growth has kind of slowed down for our school-age kids. We're really just looking for them to grow about 2 inches a year, and that they would maybe be gaining about 5 to 7 pounds a year. It's also during these years that their brain growth is complete, and this usually happens between 9 and 10 years of age. You'll also notice that this is the time where we have lots of gaps in the smile. All those baby teeth are coming out. And then the last thing to know about growth is that some of our older school-age kids may be showing signs of puberty. So that's really important to have on your radar as you're assessing patients. Even if they're only 9 or 10, we still need to be really careful and make sure that we're giving them the privacy that they need. Okay, so let's look at their psychosocial and cognitive development. So I mentioned that they're pretty motivated. Well, Erickson gives this the term industry. And school-age kids are so busy. They are learning to read and write and do math, and they're playing sports, and they're just moving to independence in a lot of different ways. And cognitively, they're able to process things in a more complex and less black and white way. They love to understand facts and processes, and this is really important as you consider prepping this age group for any kind of procedure of any kind. They really can smell crap from a mile away. So I encourage you, with the parents' help, to really speak very accurately and plainly to them. One really great thing that happens during this age is that they can process and understand pain a little bit better than the younger ages could. They still have a little bit of a tough time describing pain, but when it comes to procedures, they can totally understand that it's temporary. So it's usually during the school age that we can stop having to hold down and restrain during procedures. And this is awesome because it means that you can now put in an IV without also feeling like you got a total body workout in. So a couple of potential health problems that may come up during this age are enuresis or bedwetting, and then social and behavioral problems like ADHD. So bedwetting is pretty common in the early school years, but it can still cause families a lot of stress. ADHD is also pretty common, and it requires an interdisciplinary approach to management. So for both of these, there are just a lot of teaching points to be aware of. And both of these diagnoses have their own lessons, so make sure you check those out. Another thing that starts to happen for these kids is that they can start to experience more stress than previously. And this is because they're out in the world a bit more, so they're experiencing outside pressures for the first time. And because of this, you may see things like headaches and stomach aches occurring that are maybe more related to an upcoming performance or a stressful event. So it's really important to keep that in mind and make sure you're asking those questions that will help you know if a child is particularly stressed. Okay, let's move on to the last pediatric age group. Adolescents are ages 13 to 18 years, and after the relative sort of stability that we see in preschool and school age years, adolescents can pack a pretty big punch. It's all about this transition that's happening between childhood and adulthood. So let's look at some of the milestones that we would be expecting during this transition. Okay, the most important elements of growth that are happening during these adolescent years are all related to puberty. And one of the first things that will happen during this onset of puberty is that we're going to see a pretty big growth spurt. Kids are going to start shooting up and really growing several inches in those early years. And the age ranges for the onset of puberty are pretty wide. So like I said, some will have started showing signs of puberty before they actually reach adolescence. So there are some unique terms that are associated with puberty and sort of the sequence in which it occurs. And I've listed the two that you are most likely to come across here. So thelarchy happens approximately 11 years, and this is the development of breasts. And menarche, which is usually occurring 2 years after thelarchy, is the onset of the first menstrual cycle. If you take a look at the outline, I've got a few more details on this and the sequence of events that you would expect for both male and females. So the primary goal for our teenager is to find their own identity, and our peer groups are the most important factor and relationship that will be influencing this. It can be a pretty stressful time, all the physical changes and emotions that are going to be coming along with moving into adulthood. In addition to that, they have a tendency to view things with sort of the short game in mind, so meaning they have the perspective that nothing bad can ever really happen. When you combine all of these things together, what you end up with is an increase for risky behavior. So these kids are more likely to engage in things that could be harmful to them. And because of this, it's really, really important to ask questions about their environment and also their social and mental well-being. And to do this, we use the mnemonic device HEADS assessment. And that's just going to help you remember to ask about their home, education, activities, drugs, sexuality, and suicide and depression. And remember to always use open-ended question when you're talking to teenagers, and then always also give them the opportunity to speak to you without their parents present. And your fundamentals course, there's a lesson about risky behaviors, so make sure you check that out to get just a little bit more information on that topic. All right, we've talked about milestones. Let's move on to look at safety and patient education. So the four most important things to consider for teenagers are reproductive health, mental health, healthy lifestyle, and then transitioning to adult medicine. Reproductive health is obviously super important, and it covers topics like contraception, STIs, and general sex education. Go ahead and check out the OB lesson on family planning for more on this topic. Mental health requires a lot of attention for teens. Like I said, there's a lot of stress in that process of becoming an adult. And there's also a lot of research out there now that's suggesting that teens are under a lot of new types of pressure. And suicide rates have gone up from 2015 to 16, they went up 10%. So it's kind of scary, and it just highlights how important it is to pay attention to any signs of psychological distress that you come across in your teenage patients. Educating our patients on a healthy lifestyle becomes so important at this age, not only because it impacts their mental health, but because these guys are about to be making all their own decisions. They're about to be out on their own. And we know that obesity has become more and more of a problem for children and adolescents, so that completely needs to be on our radars when it comes to education. And last but not least, our teenagers need to be ready and prepared to transition to adult medicine. And this is especially true for our pediatric patients who have chronic illnesses, because it can be a little bit scary to go from cozy, colorful peds unit to an adult ward, and also leaving nurses and physicians that you've worked with or been taken care of by for a long time. So nurses need to focus on involving them in all aspects of care. And the two diagnoses that you'll see this become particularly important for are your pediatric patients with cystic fibrosis and sickle cell disease. We really have to make sure they're ready to move on to adult care when it's time for them to do so. Okay, guys, your priority nursing concepts for these patients are human development, patient-centered care, and health promotion. Okay, we've covered a lot here, so let's just highlight some key points to take away from this lesson. So the first two I have listed here are for our school-age kids. So just remember, school age, it's a relatively peaceful and tranquil time that's stuck between the intense first 5 years and then the intense years of adolescence. So there's potentially a little bit less going on, fewer developmental issues, and maybe a little bit less risk. The issues that you do end up having during this age are likely to be behavioral related. So make sure you think about social problems like autism and ADHD. Okay, so moving on to our adolescents. So just remember, one of the major things that's happening that you've got to know about for this age group is the onset of puberty. So be familiar with the key terms that are related to how that process occurs for males and females. Also, make sure that you're aware of your HEADS assessment so that you can really be assessing patients for those risky behaviors. And last but not least, we want to make sure that our adolescents are ready to move out into adult care and that they're educated and ready to be independent with all aspects of their health. All right, guys, that's it for our lesson on growth and development for our school age and adolescent patients. Again, make sure that you look at all the resources that we've attached to this lesson. They're really helpful in giving context to all of it. Now, go out and be your best self today, and happy nursing.